Is it okay to put EMLA after microdermabrasion? And if yes, how do we remove it in order to proceed with VFR? Absolutely. EMLA, BTL after microderm is great. It just helps it to absorb, activate, work better, work faster. Then you would just cleanse the skin of the EMLA or whatever numbing cream you're using, and then you always alcohol the skin before VFR. Thank you, dear. You're welcome. Thank you, Kara. Thank you. Bye-bye. Oh, don't leave. We're doing hands-on. Okay, so let me clear. I'm going to stop sharing my screen so you guys can see me better. Oops, I didn't mean to hit that. Okay, stop share. And do it right there. And then let's see, speaker view. How do I make me big? I just see iPad, why? I need to enlarge myself.
You are enlarged. You're perfect.
Oh, thank you guys so much. I just can't see me. So I want to make sure when I'm showing you guys hands-on that I'm like in the screen here. So it's good that I'm enlarged for you guys. Okay, someone wrote in, you are full screen. Okay, we see you enlarged. Okay. Pin on your video. Oh, thank you, Maloney. So let's see. Oh, pin video. Oh, I'm really big. Let's get that makeup underneath. Okay, very large. So now what I'm gonna just blew out my power again. Hold on one second. There we go. Hopefully that doesn't keep happening. Okay, so I'm not going to do my face obviously because I have makeup on. I have another webinar today, so I couldn't do my face, but I am going to do my neck. So let me find the right tip. I'm not going to do the 3S on my neck just because the neck is much thinner skin, so you have to be more careful with the neck. So I'm going to use the 4S. So this one here, you can see it's not too aggressive. And then I have to be careful with my vacuum because that can easily bruise. So what I'm going to do is put my thumb over the tip here, and usually you'd be wearing gloves, but I only have a few gloves left and it's impossible to find gloves because of this pandemic. So I'm doing it without gloves today, but usually I'd have gloves on. So thumb over the tip, and then I'm going to adjust that control level. And I'm gonna go to a 0.2 and see how that's working. It might not be enough. I may need to go up a bit more. Oops, someone has a question really quick before we start. How do we treat pigmentation at the corners of the lips? Okay, we'll talk about that in just a second. But you would, with pigmentation, I mean, you can take this over the full lip. So, you know, really red there. You would just really get in there. Same with the lips, just right over the lip. So I'll show you the movements that you're going to be using though. Okay, so I'm testing it at 0.2. I don't know if that's going to be enough. No, that's not enough. I never do my neck. So I went to 0.4. This is going to help with my sinuses too. Get my hair out of the way. Okay, that's much better. And on your patients, because you're not always doing it on yourself, right? On your patients, you'll be able to feel it out. You know, if you're stroking and there's like not a lot of vacuum, you feel like it's not doing much, there's no redness to the tissue, then go up a bit. Just make sure you're really keeping an eye on the skin, but 0.4 is working well. Okay, so your technique. On the face, a lot of times you need to hold areas to keep the skin taut. So when I very first came into the industry, I was taught to hold it like this and then just do small areas like that. Nah, it's just going to take you forever. So as long as you're holding areas of the skin taut, for example, if I were to do my face, I would hold here, hold the skin taut, and then just move this way, if that makes sense. If I'm gonna work up, I'm gonna hold the skin taut here. So just making sure that you're not just sticking it on and there's all this kind of like laxity in the area, that can create bruising. So just remember, hold the skin taut, like here, and then work for like the crow's feet areas, example. So the neck, I'm pretty taut on my neck, so I don't think I really need to do that here. But your motion, you're always gonna have a flicking motion. That's important. If you don't have that flicking motion and you do this, that's what creates the bruising, what I just showed you. So as long as you have that flicking motion, let me show you here. You shouldn't bruise them as long as you're choosing the proper vacuum. Now, if you were to do somebody's neck and you chose a 0.8, that's really high on thin skin. So just keep in mind that you're choosing the right vacuum and you have that flicking technique. Oh, you know what? Shoot, I didn't put a filter in. Ah! I'm not going to turn it off because I think I'm going to blow my power out. Do as I say, not as I do. Let me pop a filter in there. Good thing I didn't do the full treatment. Okay, filter's in. So you guys can see the redness, right? If I was on a 0.2 vacuum, I probably wouldn't have that kind of endpoint. So also you're monitoring, you're really watching, and you're really looking. Now, if I had loose skin on the neck, then I would be holding it or holding here. So you're always holding the skin taut in the opposite direction. So what I mean by that is if I were to work down on the neck, I don't want to hold here. That's not going to help me. It's going to still be loose. So I'm going to hold here and work away from where I'm holding because that's going to pull the skin tight. And I'm going to show you guys the final endpoint in just a second. Ah, my hair. My earrings, my hair. Back here, might as well do the whole thing. And you want to be as close as you can. I'm looking at a computer screen, so I know I'm probably not getting that perfect overlap, but if I were to actually do it on somebody, then I would want each stroke to be right next to one another. Yeah, okay. So that was one pass. You can see how red I am already. And the neck, it's a sensitive area, and I can actually see areas that I missed, right? So, okay. Now horizontally. So I may need to hold a bit. Do you see how when I went here, it was good, but then I'm still holding here, and I went here and it was bad? There's some looseness there. I need to move my hand over and hold it again. Again, you would have gloves on, so it wouldn't be your bare fingers. Curved areas are harder to do. So like when you first start working with this and you go to do the forehead, it does take some practice to keep it on and keep your vacuum activated. So if you're having a hard time with your Pristine, keep practicing the forehead, because once you have the forehead down, you can do anywhere. Just because, you know, these curved areas, you need to make sure that you're really flowing with them. So for example, if I went straight out, I lost my vacuum suction. So I'm curving it around and then flicking it at the end. Yours is probably going to look a lot more graceful because you're not doing it on a computer screen. And this is great too, because I'm going to show you guys the VFR hands-on next week. So my skin will be kind of prepped because I'm going to do the VFR on my neck. I'm going to show you guys the technique of the VFR, because the VFR is the hardest thing to learn technique on. So I'm going to show you guys that. I missed some areas here. Got a little exfoliation going on. I'll probably do, when we get off the webinar, I'll probably do my full décolleté, because on Friday, we're going to be treating my poikiloderma. So I may just do the full thing so I'm nice and prepped for treatment. But that is it. That's how easy the Pristine is. It is so, so simple. I think I pretty much showed you the full face and what to do. The full body, you would be doing the same thing. If you're using the larger one, just remember to always keep your thumb over that hole. Hold the skin taut if you need to. Move away from where you're holding, and always use that flick. Because if you choose the wrong vacuum and you're not doing that little flick at the end, and it can be just a very slight flick, doesn't have to be, you know, a huge one, but just don't pull off, pull off, pull off. That's what creates bruising. Okay, so we have a few questions here. Let me look. All right, let me start from the top here. It says speaker view versus gallery view. Oh, shoot, sorry, I should have read that. So Hillary, thank you. She just wrote in that she can select speaker view versus gallery view. So gallery view is when you guys are all up on the screen, and then speaker view is when it's just me on the screen. So thank you so much for letting me know that for what you guys need to select. So sorry I didn't see that before now. But if you're joining the hands-on on Friday, just remember that just always, because I'm not going to be doing didactic on Friday, it's just going to be all hands-on. So to be able to enlarge the screen to really see my motions, select speaker view instead of gallery view. And if you guys are watching this on your phones, I highly recommend, if you have a computer, to get on your computer, because it's going to be much larger. And since we're doing hands-on, you want to be able to really see the changes in the skin and the movements, so on and so forth. All right, is it useful to treat dark lips? Sure, absolutely. Is it going to completely change the color? I would say probably not. Will it help to exfoliate and increase blood flow so they get more of a pink lip? Absolutely. But I would always recommend doing radio frequency right after too. And that is due to just overall, again, blood circulation to the area and heat. But can we completely change the color, you know, really long term? Maybe not, but can we help really that improvement as you're doing treatments? Yeah, the lips will always change color after Plump RF. Reason being is the heat and the overall circulation and blood flow, that the lips become much more rosy. It almost looks like they have lipstick on when they don't. Oh, let's read that one, sorry. I call that noise little kisses. Oh, so somebody just wrote in that she calls this noise little kisses. That's cute. I like that. You can tell your clients They're just little kisses. And you can say that they're little cat kisses, because it does. It feels like they're licking your face. Do you use it on the underarms? Like, I do use it here because I have KP here. On the actual underarms, sure. If they have like tendency to PIH there because of friction, or like under the breast tissue, if they PIH there because of friction, yes, that can absolutely help the color change of PIH. If they get really bad ingrown hairs, or oops, let me mute someone really quick. Really bad ingrown hairs in the area, then you can do a microdermabrasion here and then do the IPL hair removal or Nd:YAG hair removal, whichever one you have. Really, you can treat anywhere with this. You can treat the feet, you can treat the hands. The hands is great. Do an exfoliation of the hands before you do your ST skin tightening. And then a protocol for the hands if they have like age spots and overall like crepiness and just overall aging in general. Do an exfoliation with your microderm, then do your RF for skin tightening, then do your IPL for pigmentation. And you can take 20 years off of somebody's hands by doing that protocol. Can we do it over the thyroid area? Sure, no problem. Like with RF, no. With IPL, you also want to pull the skin over. But with microderm, I mean, you're just removing dead skin cells on the very surface of the skin. So absolutely, you can treat the full neck without having to worry about the thyroid. Can you please show us the tip for the body? Oh, sure. That's the large one. And then, so that's the large one for the body. And then, oh, there it is. I already took it out. Here's another one, a bit smaller. Oops, shoot. Sorry, people are writing in. Let me keep up here. Can we talk about combination with infusion? Sure. I mean, so I didn't talk about infusion because we don't have it here in the States. You guys, if you're on from overseas, you guys have the infusion most likely in your country. We just don't have it here in the US, unfortunately, because it's my favorite device. One of them. I love them all, but I absolutely love it. But infusion is going to be a way of ending most of your treatments, right? For a brightening complex, for overall hydration. That's a really good standalone. Doing microdermabrasion with infusion, just that alone is a great standalone protocol. So the serums that you would use or the ampules that you would use is based on their condition. Do they need a collagen boost? Do they need overall hydration? Do they need a brightening complex? So if it's something like melasma, I still recommend for them to prep their skin every day before an IPL treatment with melasma. But you can also incorporate infusion. So you could do a microdermabrasion, then do the brightening complex, and then go in with your IPL. So it's just a little extra safety there. But yeah, you can always use the infusion to finish all of these treatment protocols. Like if you're doing the hands, microdermabrasion, then ST to tighten the skin, then IPL for pigmentation, now a collagen booster or overall hydration with the infusion. Absolutely, this can be used in combination with each other. That actually, I think it was, who asked that? Omar, hi Omar. You know, that makes me think that possibly I can do an infusion webinar. I have to figure that out though, because we don't have it in the States. So doing it for our overseas clients would be great. So let me think about that, and we'll probably schedule an infusion one, just an overall webinar on it. Can we perform Pristine in cases with severe acne and cystic? Can we perform Pristine in cases with severe acne and cystic acne? Yes, you just have to be very careful. very, very careful with that really active cystic acne. Either avoid it and go around it, or be very gentle with it. If you see anything opening up, you just don't want bacteria to spread. So do areas that does not have the cystic acne to exfoliate, because we want to make sure we're getting a jump start on any acne that they could then have in the future, like few days from that day or the following week. You can go around the cystic acne very gently at a very low vacuum level. Just make sure that nothing is opening, because you just don't want the acne to, bacteria to spread. What should not be done on recently tanned skin? I was talking about IPL, but tan skin in general, so just be careful. I was referring to the IPL, not microderm. But even if they were out in the sun all weekend, think about how then their skin is going to react to any of these treatments. If they were really out tanning, their overall skin is going to be dehydrated as well. So it's just not the best to really like bake in the sun and then have treatments overall. If they were careful, if they were wearing sunscreen and, you know, they didn't get a sunburn or something like that, then it's fine. You can do microderm. What was I going to say? Oh, and just be very careful. If there's any type of sunburn, just blew out my power again. If there was any type of sunburn, you just have to be very careful with doing any type of treatment, because that would create complications to their skin, even something like a microderm. Hold on, let me just hit my circuit again. I just plugged the system because I don't need it anymore. Okay. How can we treat with rosacea cases? Oh, rosacea, great combination there is doing the microderm still, just very, very gently. Be very careful with your vacuum on rosacea. But it helps because a lot of rosacea clients will have just overall drier skin, and they can have bumpy skin. So it can really help with that overall bumpiness and the texture in general. But because the area is a lot of times dry and almost irritated, you just have to be so, so gentle with your vacuum and with the coarseness of the tip that you're choosing. Choose something that is much less coarse and a very low vacuum, just to do a slight exfoliation on the skin. Then you would go in with your IPL, and you would, I prefer the 580 for rosacea, but the 580 or 530 both work. Have some dead skin cells hanging out. So that's a great combination, using the IPL with rosacea. Fabulous insights. Thank you. Oh, thank you, Dr. Simple A. Hi, how effectively does it treat stretch marks, and how many sessions are recommended? Listen, I'm not going to say that microdermabrasion is going to completely treat stretch marks and get rid of them. Really, stretch marks are hard. Why? Because stretch marks and scars, there's dead skin cells in the area. But luckily, the dead skin cell, the stretch mark or the scar, is surrounded by healthy cells. So those healthy cells are going to help shrink the size of the stretch marks and scars and the overall textural issues with stretch marks and scars. So microdermabrasion is going to be a great prep to those for other things that you're going to be using with it. So you can go a bit more coarse with your tips if you need to, a bit higher in your vacuum. They're going to probably turn really red, so you can see the blood flow in the area, so you know you're increasing that circulation, so you're getting that overall oxygen to the tissue. Then you would go in with like numbing cream and then do the VFR. If you don't have the VFR, then you would go in with your SP, even your V-form handpiece. And after that, if you have microneedling, then you can microneedle over the stretch marks and scars. So there's all these combinations that you can do to help the textural improvement for sure. Now, I can't give you like a percentage that 80% of the stretch mark will be gone. It's not that, because they're hard to treat. It is, we're really minimizing the size of them, and and the overall textural issue and the appearance of them. So with those, microderm would just be your prep to anything else that you would be doing or using. Thank you. Oh, you're welcome, Omar. We'll work on that. Is infusion galvanic? Yeah, it's a, what's the word I'm looking for? Electromesotherapy. So we're able to just take those serums, those products, hyaluronic acid, brightening complex, and really get them deeper into the cells. So we get a better response with hydration or overall collagen or, you know, targeting melanocytes. So not galvanic, but electromesotherapy. Do you use microderm on rosacea? Oh, okay, I just answered that one. What's the main difference with oxygen facial oxygen? I don't know that. I don't know, I'm so sorry. I can't help you with that question. Maybe you could write in and explain, and then maybe I can understand that question a bit more. Thank you for a wonderful session. Oh, thank you, doctor. So happy that you were on. Thank you for today's session. It helps a lot. Oh, good, good, good. I'm so happy to hear that. There's a big trend with hydrodermabrasion. Could you please give us some competitive advantages regarding Pristine? Oh, like something like hydrofacial? Well, here's the thing. With something like where we're really using our microderm more so is a prep for all the other technologies that you have to offer. So hydrogen facial, it's not going to be able to do that as well. Just a standalone microderm, just to be able to give exfoliation and overall blood circulation to the tissue is the perfect prep before any type of other treatment. Where hydrofacial, because there's liquids to it, and especially if you're using something like, what do they use? Whatever they're using for peeling, then you can't do any other treatments after. If you guys already have hydrofacial, then just don't use any of your liquids with it to not make the skin sensitive to the treatments. Now, the infusion, the one we were just talking about that I'll set up a webinar in the near future, that is them kind of combined. So microderm with the mesotherapy to be able to deliver those products deeper into the skin cells. So I don't know if I can say this. Coming soon, we will have a product like that in the US. So yeah, I won't, we won't get into all of that, but if you are overseas and you have the infusion, it's those two combined. Where that's a positive that you have the infusion and the Pristine is that if you just need to quickly prep somebody's skin for all these other technologies, you can. You don't have to worry about serums and other things that can make their skin sensitive. It's just a perfect diamond tip microdermabrasion to quickly prep. So I hope that helps. If you are a client that has the infusion. Many of the patients are worried while doing microdermabrasion. They feel that skin may get loose because of suction. How to explain to them? I mean, explain to them that the vacuum, the amount of vacuum that you're using, it's not a possibility. Additionally, if anything, you're going to be doing the opposite. Just explain to them, oh, somebody's camera came on, just explain to them really how that blood circulation works. And when we get overall blood circulation, which is what the vacuum is doing, it's aiding in so many positives. So we're bringing overall, again, that oxygen to the skin cells, therefore overall nutrients to the tissue. So we're making the skin at a better integrity than it was when they came in. So the amount of vacuum that you're using, plus, I mean, to really make their skin loose, they would need to be using a really strong vacuum, some type of, I don't know, strong vacuum every day to create actual damage to their elastin. So the amount of vacuum you're using, plus talk to them about the positives of the vacuum, that we're actually doing the opposite. I hope that helps. I've never heard that before. That's the first time I've ever heard that. So I hope my answer was okay. Thank you, you're amazing. Oh, thank you. Can infusion be done to treat lip discoloration and hyperpigmentation? Yeah, absolutely. You can use the brightening complex on the lips. You know, if you do have the infusion, which I don't want to talk about it a lot on this webinar, just because our US accounts on here do not have the infusion. So I'll save all of that for our webinar in the future for overseas. But the brightening complex can be done over the lips. Additionally, if they have very dry lips, after you microderm them, then you can use the hyaluronic acid ampule, and that really helps hydrate the lips. So, yeah, it's great for the lips for sure. But don't fret, US customers, because we have something coming to you in the near future that you're gonna really love. Okay, thank you. Another webinar need to run. Oh, requesting a class for how to best combine therapies. We'll finish this webinar on the member portal. So if you, the overall combinations, I spoke about those on every webinar. So when I was on with the IPL, I spoke about the combinations there. When I was doing the RF ones, I spoke about the combinations there. So you guys can always go back and watch those, the ones that I've already covered. And additionally, on Friday, if you guys are joining us, I hope you do, I'm going to be using a lot of technologies together. So you'll be able to actually see it. Thank you for a wonderful session. You're welcome. I love how many people are writing in. Thank you, Kara. Amazing as always. Thank you. Oh, hello, love. Hello. Our Irish distributor is on. I think that's my favorite country. I really loved it there. Look forward to the next session. Good. Yay. I hope that you join us on Friday. Very useful, Kara. Thank you. Thank you. And you're welcome. Oops, I just scrolled too much. Oh, I scrolled way too much. Whoa, I went way up. Hold on a second. Thank you, Kara. Fab. Thank you. If we are to combine it with IPL or laser, is it the same number of passes? We do 2 or less vacuum and just 1 pass. No, I mean, no, it's fine. 2 passes is fine. If you're concerned in any way, just because their overall skin maybe is concerning you, maybe it's thinner skin, then just do less vacuum and a very, the tip that really doesn't have or has more crystals, I should say. Let's see, do I have it here? I don't have it out, sorry, or it's mixed up somewhere. But you know, use the 4S or the, I'm sorry, I keep getting mixed up. Use the 1S, wait, I'm confusing myself here. Use the 5S or the 4S, that's what I meant to say. Not as coarse, not as aggressive. But really, when you're doing combination with RF and IPL, I do it just like I would treat anybody else. You know, 2 passes, the vacuum level that patient needs to be at, the coarseness that patient needs to be at, and you shouldn't have any type of complications. Okay, what is a typical charge for microderm on the face? Oh, we answered that. It's typically between 100 and 300 per treatment. That's if it was a standalone treatment. If you're going to do it as a skin prep to a combination package of like RF and IPL, let's say, then I wouldn't so much charge them for that. I would just build it into the price, like build it into the combination price. We talk a lot about this in the practice development as well, pricing how to build combination packages and present it to your clients. So that's going to be next week. You guys can join us on that.
Few questions?
Of course.
Okay, hi, it's Cynthia. In the
Hi.
ear, inside the ear, would you
Yeah.
inside the ear?
Oh my gosh, that's the best question. Thank you so much for asking. Absolutely. So a lot of people get blackheads in this area, right? So this one is amazing for that. So you can really insert it in here. You can use a higher vacuum because this is so small that you can use a higher vacuum. By the way, I'm so glad you asked that. I use a 0.8 vacuum with this one on the nose. So same with the ears, because it's a tiny tip that the vacuum really isn't all that strong. So 0.8 on the nose, and then inside the ear here, and then inside here. Absolutely. Great, great question. Is certification needed to do microdermabrasion? That really varies on if you're in the US, it's based on your state that you live in. If you're overseas, then it really, really varies. So I would just check with your medical malpractice, also your overall aesthetic and medical aesthetic board within your state. Thank you guys again so much for joining. We truly love you guys. You are part of our Viora family, and we want to continue supporting you guys throughout this really, really hard time. So we're not going anywhere. We're going to continue doing these and really get through it together. So thank you guys. Stay healthy. Stay inside because we have to. And I'll see you guys on Friday. Okay, bye-bye.